Alrighty, everyone, we're going to go ahead and get started. My name is Micah Matthews. I am one of the marketing directors here at Messer Financial Group, and I'd just like to start off by thanking everyone for taking the time out of their busy schedules to join us today. We know that your time is precious this time of year, and we want to make sure it's worth your while. I think you're going to get a lot of great information. I'm extremely excited to introduce Mark Capagrossi and Wes Antonin. They are the national broker sales reps for Anthem, and a great resource for us to have. If you ever need anything, they're available. You can also contact Messer Financial. But we're going to go over a lot of really good information on what kind of updates we have with Anthem. I know everybody's been wondering what's going on. Are they going to be competitive, et cetera, et cetera? So we figured we'd go ahead and bring the head guys over and explain it to you themselves. But before I turn this over to them, I just wanted to go over a few things with you real quick so that we can all be on the same page. What you're seeing on your screen right now is the Messer Financial Group homepage. Here you will be able to locate just about everything that you'll need for basically any kind of product line you're selling. But for this purpose, I want to specifically focus on the under 65 market. So if you look at the Agent Resources tab on our homepage, you'll see there's a number of different options. All of our webinars, just in case you ever miss one or ever want to go back and watch one from a while ago or whatever the case may be, is located right here at the Messer Learning Center. So even this webinar that we're doing today will be posted on our website, usually on Tuesdays, so it'll be posted next Tuesday. But just to show you that real quick, I'll click on Messer Learning Center. It'll break it down by products. If you want to see what's the newest ones, you hit Just Added, and it'll come up and it'll show every single one that we have here that we've done. So again, if you miss it or whatever the case may be, you're more than welcome to go back and answer and watch these videos at any time. Also, under Agent Resources, there's going to be a tab that says Quote Tools. Once you highlight Quote Tools and click on that, it's going to take you to a number of different quote tools. We have a quote tool for just about every product that we offer: ACA, Medicare, life insurance. If you need forms, underwriting guidelines, whatever the case may be, we probably have it here on your website. But for this purpose, let's focus on the health quote. So if I click Get Quote, it'll take you right to our enrollment platform. This is Messer Financial's enrollment platform. This quoting tool right here is completely free of charge to use, to quote. However, you will not be able to enroll unless you actually purchase the platform, which is $65 a month. You can turn it off whenever you want to, but just to show you real quick just how easy it is, I'm just going to do North Carolina real quick because that's where Messer Financial is. Let's just say 28227. This will work anywhere in the country, and it works the same way. You pick your county, choose the effective date. 1/1/19 effective dates are on here. We'll come down here to gender. We'll just say a male. We'll do 1/1/1980 for this purpose. Tobacco user none, and then we'll hit next. So not only will it quote the ACA plans, it'll also quote some of the ancillary products, short-term medical, gap plans, dental, vision, whatever you want. It's all available here. But again, we want to focus on ACA, so let's go ahead and choose medical. If you want to see if they qualify for a subsidy, you can hit yes or no. We'll just hit no for this purpose. And then whenever you hit next, it's going to come up with all the different plans, and it'll list them from lowest premium to highest premium. You can see the providers. You can look up RX, summary of the details. You can pull up brochures. Anything you want, guys, is going to be listed here. And even if they qualify for a subsidy, it'll show you what the premium is after a subsidy. Very, very easy to use. You saw how fast I just quoted that, and that was also with walking you all through it. I highly recommend it, and if you want to use that, you're welcome to purchase it as well. Just let us know, and we can set you up on it. But just wanted to make sure that everybody saw that and was aware of how to do it. And then with that, I'm going to go ahead and turn it over to Mark and Wes. And Rebecca, if you would go ahead and share their screen, we'll be good to go. So Wes, Mark, it's all yours.
All right. Hey, appreciate it, everybody. And appreciate the opportunity to speak to everybody here this afternoon. Really do appreciate it. Wes and myself here at Anthem Blue Cross and Blue Shield really I mean, we appreciate the relationship with Messer Financial, and we know the ACA market out there has been kind of up and down lately in the last few years, but we're here, and I don't think we're going anywhere. So with that, I'll just kind of jump into kind of the material that I kind of want to hit, and I'm going to hit a lot of stuff fairly quickly. I know time is very important to everybody, but I just, as he was just going over the Messer financial quoting engine, which looked really good in terms of being able to have everything in one spot, which is great. Anthem also has its own direct portal for under 65 business as well. It also has a place there for in the business that you guys write with Anthem, regardless of the state. If it's an Anthem state, of course, like Georgia, Virginia, which sounds like those are the ones you'll be focusing on. But couple of things I wanted to show just within our own portal, we do have the ability to quote both on and off exchange, assuming that you are certified with the FFM. And it's very easy. You can just click quote, and just very similar to kind of what Michael was going over in terms of how you go through the quote and how you get them enrolled. Window shopping is available here as well, so you can almost start going out there and playing around and start quoting today. One of the things I wanted to kind of hit is these reports functions. As your business starts to grow with Anthem, keep in mind these are under 65 individuals. They will start to age out into a Medicare-based age. You also have family policies out there. If you get into some of the group stuff, etc., you will have people that start to age out of the child only or the child kind of policy or dependent into a 26 or 65. So here under the reports tab, you'll be able to go out there on a monthly basis just to see who within your book of business is 64 and now turning 65 by simply just clicking on new report, going to an individual, members turning 26, 65, naming the report, and going through and creating it. You can see here that it basically creates them all in Excel format for you to, of course, download, manipulate, and do whatever you need to do to kind of keep that client member under your umbrella, which I think is extremely important. If you guys have any questions throughout this presentation, feel free to ask. There should be a place there to ask questions within the GoToWebinar. Do me a favor, if you have a question, ask. I'll be more than happy to try to jump right on it and try to answer it. If for some reason I do miss it, I will say that I will answer most, if not all, questions at the end. So just wanted to share that with you guys. So I'm going to jump in just on some of the Anthem stuff in terms of really you have different options to quote either through the Messer tool or through the Anthem.com direct broker portal. Either work just fine. But for Anthem, just wanted to kind of go over just everything else and some of the highlights as well. First is the agenda. We're going to talk about mobile apps, talk about some of the portal updates, which you kind of saw, but we're doing some updates, which are going to be really cool. Hit certification and subsidies, which if you are an agent selling on the exchange and been selling it for a couple years, should just be a quick review. How to find doctors, talk about some of the federal updates. And then we're going to talk about the 2019 medical products that are going to be available in Georgia, Virginia, as well as some of the specialty stuff. I'm also going to show you guys, because I think Georgia and Virginia are going to be really great opportunities. And I'm going to really kind of show you where our footprint is down to the county level, where we are re-entering and where we are the sole carrier. I mean, we're the only option. So a lot of great information we're going to hit. And again, Q&A, feel free to ask any questions as we go through it. So why the mobile app? Why Anthem Anywhere? I think it's a great place for your clients, members, to be able to have access to all their insurance needs right on their smartphone. I think we can all agree that most everybody nowadays has a smartphone. Simply write them an Anthem policy, have them download the Anthem Anywhere app, have them log into it, and they can find providers, find urgent care centers, estimate costs, chat with Anthem Direct. They have a copy of their ID cards right there on this app, which is great. As you can imagine, during open enrollment, there's a lot of ID cards going out. Some people need them sooner. Some people don't really care. So here's an opportunity for people that may not have their ID card right out of the gate to download this app and have access to it fairly quickly. They can review their benefits, prescription claims, have a summary, but there's also a place there for them to make some sort of payment or schedule an auto pay. I know some people may write a check, send it over to Anthem. They can check the payment history as well to kind of get an idea if that thing's gone through, and to make sure that their policy is up to date. So that's Anthem anyway. Again, just wanted to show you that. Some of the broker portal updates, as you go to the anthem.com, log in, you're going to see some broker portal reimagined. Basically, long story short, we are now compiling all the Anthem business into one report, which is going to be real nice. And there's going to be some other updates over the next few months as we get into first, second quarter of 2019. But right out of the gate, thinking about how does this affect me today? Again, if you have Anthem business out there, more than likely you want to keep it. There's places out there where you can check your renewal and check those renewal options of where Anthem, what your customer is at, what their current plan is, their premium, and what we may be mapping them to, and estimated costs and so forth. You can see your entire book of business out there. You can sort this any way you need, just to kind of make it easier for you to do business with us. And a lot of other great new functions that you'll see out there. And not to waste a bunch of time on it, but just wanted to make sure that you guys were somewhat aware. So jumping into certifications, to sell on the exchange, which I'm sure you've heard this hundreds of times over the last few years, certification is required. If you're going to be selling on exchange in any of the FFM states like Georgia, Virginia, please go out there and complete that certification sooner than later, with open enrollment a couple days away. Why get the certifications? Why sell on exchanges? Mainly because of the subsidies that are available. Two types of subsidies really are the premium subsidies and cost sharing subsidies. Premium subsidies are for anybody between 133 to 400% of the federal poverty level. Really, premium subsidies have really helped make the plans affordable for people to purchase. Where the cost-sharing subsidies are for people that fall between 133 and 250% of the federal poverty level. Cost-sharing subsidies really kind of help make the plans more affordable for them to go out and utilize. So a lot of benefits here for on exchange. Premium subsidies to make it affordable, cost-sharing subsidies to make it affordable for them to go out and use if needed. As you can see, there's a large range of individuals based on adjusted gross income and their household that may qualify for some kind of subsidy and or cost-sharing subsidy. So really just kind of wanted to briefly hit some of that quickly with you guys this afternoon. More of a refresher here. As you do quotes, regardless if it's regardless of the portal access that you may have or use, you'll see some name conventions for the cost-sharing subsidies. The S04, S05, and S06 will be the kind of indicator of where these individuals fall within the federal poverty level. The S04 are going to be for the 200 to 250% of the federal poverty level. The S05 between that 150 to 200, and that S06 are going to be for the individuals or families between 133 to 150% of the federal poverty level. Any AI products or plans or indicators at the end of the plan name, those are American Indian-based plans. Hopefully I did that fairly quickly for everybody. Jumping in here to how to find a doctor. Now all states, including Georgia now, basically you can just go to anthem.com. Once you're at anthem.com, you can just click on providers, which is right there in the middle of the screen, which is highlighted. Once there, click on find a doctor, and then select the state in which you're looking for. Once there and choose your state, you want to search by selecting a plan or network. And this is the important spot, because I think a lot of people have made mistakes in the past by just generally choosing a network, not knowing exactly what network to pick. But when searching for a network within either of those two states, it's important to choose the pathway network. That way you can give your client an accurate reading of the providers, specialists, hospitals within their area for them to better make a decision. Once you're in there, you can, of course, see the different provider names that are available as well as their location. You can click on their name, find some additional information about that particular provider if needed. If you need and prefer to email that list to your customer, you can do that. Very simple. Click the email, put their email address in, and it will be sent. It will be coming from Anthem, an Anthem server, so just have them kind of keep an eye out for that. Keep in mind that, in this example here, there's a little over 3,000 doctors or providers in this range. When emailing, the email will only generate a report, a PDF report of the max of 250 providers. So if you're wanting to narrow that down, you can come over here and just push this thing over here to maybe 10 miles or 5 miles to kind of narrow that down. If and when emailing it, it is going to take the first 250 of the closest providers or specialists that you're looking for to your client. So even though you may tell them there's 3,000, the email will only send them the 250, which again are going to be closest to their location based on the search that you did. I do know that brokers, agents, as well as the consumers will sometimes call their providers just to make sure. It's important to make sure that when they do that, it's not to ask if they take an Anthem or an Anthem Blue Cross and Blue Shield product. It's extremely important that they call and ask if they take the particular network, which in this case is going to be Pathway again. Where'd it go? All right. So the reason that's important is because Anthem does have a tons of different networks out there based on the different products that we offer. And when calling providers, if they say, well, is it on exchange or is it off exchange? It doesn't really matter because Anthem uses Pathway for both on and off, and we also use it for many of our group products. So it's just trying to make sure if someone is trying to confirm if the provider accepts the Pathway network, and when they call them, it's just making sure they ask the correct questions. That's all I wanted to hit there. Live Health Online. This is an Anthem company as well, but Live Health Online is really a convenient way for members to interact with a doctor, live two-way video over their computer, mobile device, their tablet, whatever. Live Health Online is also a mobile app they can download, but this basically gives your clients the opportunity to see a doctor pretty much 24/7, 365 days a year. This is going to provide people in your clients an in-network U.S. board certified doctor. It's going to help with the cost of seeing a provider. It's also going to help save a bunch of time. With this system and with this service, not only will the doctor be able to see you, ask questions, see whatever it may need to be seen, diagnose you, and then, of course, maybe even send a prescription down to the local pharmacist. The reason I hit Live Health Online and have been hitting it over years, the trend for online provider tool and provider systems has continued to go up each year, mainly because, you have people that need to seek care for, whatever. Maybe it's a minor stuff, sore throat, pink eye, maybe it's a rash. But people with children or people that work maybe 1, 2 jobs, or people that have children in school or daycare, they just don't have the time to go out and see this provider to get diagnosed and take care of themselves. Here's an online web-based provider that not only will see you, can send a prescription down to your local pharmacist. I stress Live Health Online really because of our new Online Plus plans that are available both in Georgia and Virginia. These Online Plus plans are basically give people an unlimited online primary care physician office visit. So in the past, you've seen ACA plans, individual plans with maybe some limitations on the number of times they can see a primary care, limitations on the number of times they can see a specialist, and so forth. These Online Plus plans give people unlimited office visits for either $5 to $10 per visit. Definitely saves member time and definitely saves them money. You can see here on this particular example of a plan name, Anthem Bronze Pathway HMO 4500 Online Plus. That Online Plus at the end of the plan name, that's the indicator that these unlimited online office visits are going to be available. So keep it, if that's something you're interested in, look at the product brochures and kind of take a look at where those plans are, what they are, and make sure they have the Online Plus at the end of the plan name. All right, speeding right along here, talking about some updates here for the federal side. For 2019, you're going to see the out-of-pocket maximums increase a little bit to $7,900 for an individual, $15,800 for a family. We talked about some of those cost-sharing plans here. You know, the S04, it's going to go up a little bit to $6,300, $12,600 for a family. In the S05, S06 plans that we brought up, you'll see that those out-of-pockets are at $2,600 for an individual, $5,200 for a family. So talking about HSAs, high deductible health plans, you can see the HSA contribution levels, again, kind of going up a little bit. Someone who has an HSA can contribute up to $3,500 for an individual, up to $7,000 for a family. Anybody at the age of 55 years or older can actually do a catch-up contribution of an additional $1,000. HDHPs, or high deductible health plans, as non-copay based plans, just deductible co-insurance is considered high deductible plans. The minimum of the deductibles are staying the same. They're $1,350 for an individual, $2,700 for a family. And the out-of-pocket maximums for high deductible plans is going to be $6,750 for an individual or a single, or $13,500 for a family. Both of those have kind of trickled up a little bit. So talking about payments, products, and so forth, you know, selling both on and off exchange, it's important to make sure that those coverages are bound. You know, individual for the on exchange, you know, we always stress the initial of capturing that initial payment at the time of application. If for some reason someone decides not to make that initial payment at the time of application, Anthem will send out a letter to them letting them know their premium will be due 15 days from the letter being sent out or the effective date of the policy, whatever's greater. For off-exchange apps, you know, payment is required at the time of application, and that payment's going to be processed within 24 to 72 hours of hitting submit on the application. Good way for people to kind of keep an eye out and make sure that they have funds within their the account they choose. Your customers, when you write these apps and policies, they're not going to be enrolled until that first month's premium is received. They can use a credit card, Visa or MasterCard. There is no Discover, no American Express, just Visa or MasterCard. They can set up an EFT through their bank. They can use a paper check, which on the application will convert it over to an e-check, or submit a money order of some kind. On exchange, you know, as I mentioned, premium's not required at the time of application, but we highly recommend payment capture. There's too many things going on in the months of November, December, early January, where people may allocate those insurance dollar funds to something else. And, that's why we recommend payment capture. If you're going to spend the time, effort to educate and enroll somebody in an on-exchange policy, try to capture that payment so you yourself will get credit for the sale. As I mentioned, off exchange, that premium is always required. All right, so keep in mind, if you know, as people make those payments, there is an opportunity, unfortunately, for that payment to be rejected, and they can be rejected for a number of reasons. A lot of times, there's insignificant funds in the bank or checking account or credit card. Sometimes I've seen people, data entered, an account number, or maybe the credit card's expired. There's so many different reasons why something could be rejected, but I'm stressing this more on the on exchange because the client's application will be declined and the applicant will need to reapply for coverage. The reason I say that's important is that we do have a lot of customers still that are prolonging when they enroll in an on-exchange policy. And so if they wait till the last minute, the last day, if that their payment option is rejected, regardless of the reason, they're going to be out of luck and not going to be able to secure coverage for the year 2019. So keep that in mind. Off exchange, payment must be, if it's rejected, that payment must be received by the end of the open enrollment or 10 days following the assigned effective date, whatever is later. So off exchange, rejected payments, a little bit more leeway. Ongoing payments, it's always important to let people know their payment's going to be due at the first of the month. They can either accept a paper bill that comes into their mail. They can set up a bank draft, EFT. We now have the reoccurring credit card with a Visa, MasterCard. They can go to Anthem.com to do the online portal. Utilize Anthem Anywhere in the mobile app, as we went over at the beginning of the presentation. Or simply flipping their ID card over, calling customer service, and customer service will be able to take any of those kind of payments right over the phone. Reoccurring credit card with Visa, MasterCard is now available and can be set up on the initial application, which is really nice. If they're doing an EFT or that reoccurring credit card, they can choose the date in which it's going to be drafted. It's usually between the 1st and the 5th of the month. They can just choose what date and which date or day may work better for them. A couple things that we talked about, that's important in terms of to a customer. I think for the individual and the individual ACA market, price is always going to be king. Making sure that my doctor or understanding what doctors are within my network is also important. I think the third one too is making sure that if I'm on prescriptions, I want to make sure that they're covered. So that's kind of what I'm going to hit here in terms of the pharmacy benefits. When utilizing pharmacy, the pharmacy network, we're going to use the National Plus Pharmacy Network, which nobody should ever have an issue of finding someone that's going to fill their prescription. In the state of Georgia, though, we do have an RX Choice tiered network, which is simply a subset of the National Plus network. Basically, people that utilize that Choice tiered network will be able to get a lower cost for their medications in Tier 1 and Tier 2. Typically, it's not as many locations, but they're going to simply be some of those larger, more frequently seen, big box office kind of locations like CVS, Target, Kroger's. Some Walmarts are in this select tier, but making sure that they know that, in Georgia, there is some options and some options out there for people to buy and pick up those prescriptions at a lower cost. Unfortunately, Virginia does not have that, the RX Choice tiered network, but Georgia does. For both states, we use the Select Drug Formulary. It's a great formulary, by the way. This formulary offers medications in every category and class. We also have included the top 25 most utilized medications based on Anthem's claim volume. It also includes medications in therapeutic categories and classes, and it typically meets and or exceeds the ACA requirement. I would say for Georgia, Virginia, our formulary is going to exceed the formulary requirements. Keep in mind that this Select Drug Formulary is considered a closed formulary. So basically, if a doctor writes a script for something, or if someone is being prescribed something that's not on the formulary, it's not covered. Keep in mind there are exceptions to all rules out there. Typically, the rules and the exceptions we see are when the provider writes a script for a brand medication, when there are one or multiple generics available. The exceptions kick in if the customers tried those brands in the past or tried the generics in the past, they didn't work. they had side effects of some kind. Those providers know the steps that they need to do to get those exceptions granted, so Anthem can make sure that these customers, these members, get the prescriptions they need and the outcomes they deserve. You can search for the select drug formulary. You can find it on our website. You can simply almost Google it nowadays. But the select drug list is the formulary that we're going to be using for both of those states, Georgia and Virginia. In Georgia, we're huge expansion in Georgia this year, and we'll kind of hit that because I know that's one of the big questions out there is where we're going to sell and so forth. But the answer is part of the question. This is what we're going to sell. We talked about the formulary of the select drug list, the networks to pick up those prescriptions. I will say there is a mail order or home delivery choice option for people. Again, this is optional for people that are on maintenance medications like high blood pressure, cholesterol medicines, and stuff like that. They can simply get a 3-month supply mailed to their house. For both on and off exchange, you're going to see a Pathway HMO product and a Pathway guided access HMO product. The guided access you'll see are going to be really mainly concentrated in the metropolitan area, and we'll show you that in the next slide. Primary care physicians are not required in the Pathway products, but they are going to be required on the Pathway guided access product line. If at the time of application they don't know who their primary is, or they're just second guessing it, don't worry. Leave it blank. Anthem will assign one to them, and then when they get their ID cards in, they can of course change it at any time. Simply call, do the research, find what provider they want, call Anthem, and they can of course change it fairly quickly right over the phone. When it comes to referrals, meaning going to see a specialist of any kind, no referral is required on the Pathway product, but a referral is going to be required on the Pathway guided access product. Both on and off exchange products have a limited blue card. Basically, you need to stay in the network, in the Pathway network or the Pathway guided access network to get in-network benefits, unless it's an emergency or the client or customer needs urgent care, meaning that they're out of network, they're out of the state, regardless of where they're at. If they need and have an emergency or they need and require urgent care, all those benefits are going to be paid as in network. So one of the big changes you'll think is that Georgia has always been branded Blue Cross and Blue Shield of Georgia. As of 1/1/19, that branding is going to switch over to the Anthem Blue Cross and Blue Shield. We're going to be offering plans in 75 counties. We've expanded into 31, and we're going to be the only carrier offering plans in 44. And I'm going to show you some of that here after the next few slides. So the plans are going to vary depending on the location of the customer. As you can see, the guided access Pathway products are going to be available in the counties listed there. The good thing is when you do a quote in Cherokee or Cobb, that's the plan that you'll have available. There's not going to be a Pathway guided access and then a Pathway product. It's going to be one or the other. If you are selling in Georgia, I will say that Anthem has done a really good job of expanding the network in the Metro Atlanta. We've landed a huge contract and really good negotiated prices with Northside Hospital and the Northside Hospital doctors chain. So you're going to see some really good competitive products, both on and off exchange there in the Metro Atlanta area. So keep that in mind. The Pathway product line in the list of counties that you can see there, Pathway is going to be more of a utilized out there in the kind of the more of the rural parts of Georgia. Again, still really good competitive products, but just not going to have any crossover between the guided access and just the standard Pathway. The Online Plus, as I mentioned before, it offers that unlimited primary care online doctor visit for simply $5. Pretty good, easy way to save money. Jumping into the state of Virginia, We talked about the Select Drug Formulary, the National Plus RX Network, and the Home Delivery Choice, which again is for maintenance medications. You'll see that the network available in Virginia is going to be the Pathway and the Pathway tiered HMO product. There is going to be no primary care, no referrals required, same limited blue card in case of an emergency or if they need urgent care. So nothing really changed there, but very similar to what you saw there in Georgia. Anthem is going to be offering plans in 110 counties. We've expanded our footprint in Virginia into 48 counties for 2019. We're going to be the only carrier of choice or only carrier option in 52 counties. Simplify the product line to 9 on exchange, 9 off exchange. You can see that for primary care web visits, including Live Health Online, they have the same primary care office visit cost share, except the Online Plus plan. So it's again making sure people you identify those Online Plus plans and show people how they can utilize that at a much lower and easy time cost, ways to save some time as well as save some money. The Online Plus plans offer a $10 PCP or primary care office visits, which are unlimited. We said that this is a Pathway tiered network. The tiered is basically letting people know that there's going to be a tier 1 and a tier 2. Facilities, hospitals, and facilities that fall in a tier 1, they're going to basically get they're going to pay lower amounts for those hospitals and facilities, and it's easy for them to indicate what those hospitals and facilities are by just going to the provider finder that we kind of reviewed at the beginning of the presentation. That hospital will either have a tier 1 or a tier next to it when doing that search. You're going to see a new life insurance product. It's like a term life insurance product that's going to be out there. If you're doing quotes through our broker portal, hopefully it's out there on other portal options that you may have access to. The benefits amounts are flat, $25,000 or $50,000, available to anybody 18 or 64. Excuse me. If all coverage is term at the age of 65, you can buy it as a standalone product. You can bundle it. No medical exam, just a short health questionnaire to get these these term life insurance policies bound for somebody. All ACA plans have the pediatric dental, pediatric vision. That's all new. I mean, that's all the same from the years past. If anybody's looking at separate dental policies, we do have those out there as well. Those are going to be the dental prime, plan A, B, and C. Plan A is kind of more or less a preventative benefit. Plan B covers the preventative with no waiting period. But it also covers some basic services like billings and so forth after a 6-month wait. Plan C covers preventative, covers that basic services out of 6 months. But it also covers some of the major services well after a 12-month waiting period. Plan C also has a little bit more of a increased yearly limit per person. So Plan C is probably going to have a little bit higher cost, as well as covering some of that major stuff like crowns and dentures, bridges, and so forth. You're going to see some additional dental plans. These are the family plans. You're going to have a family value product, family plan, which is kind of in the middle of the road. But you're going to have a family enhanced product. It's going to have a lot better in terms of higher benefit amounts for services, higher annual maximums for adults. But it's also going to cover services for cosmetic orthodontia for children 18 years or younger. If that is a benefit that people are looking at, definitely take a look at the benefit grids. Check the waiting periods, because I'm sure it's going to be a 12-month waiting period for some of those additional services and benefits. When it comes to the vision products that you'll see out there, as well as the pediatric vision, we're going to utilize the Blue View Vision Network. It's a great network. You're going to see, look at the brands there. You have Sears, Target, JCPenney's, Pearl. For anybody that has contacts, Anthem Blue Cross has the only in-network contract with 1-800-CONTACT. So just another way of showing and people utilizing our in-network to save money, as well as get their contacts delivered to their house in a convenient way. So one of the things I wanted to hit, and I know I kind of went through that fairly quickly. Hopefully everybody is happy with that. But part of what we do here, Wes and myself, with Messer Financials, of course, we help target certain areas. We do all that in the back. But for you guys as the sales agents, we want to make sure that you guys get credit for all your sales. I can't stress the idea of tracking sales, making sure that if you track them if you don't see them within your book of business, or you're getting credit for those sales, that if you write their name down, if you take their exchange certification, their social, a date of birth, address, typically we need 3 out of 4 of those for our team and our reconcile team after open enrollment to dig through our database to find these people, to make sure that they're enrolled, making sure your broker information on the back end is correct. That's extremely important for Wes and myself. I can't stress it enough, because you as the Messer agents, you guys get credit for those sales before we do. So it's important that you all and we help you get credit for every one of your sales. So Wes and myself get credit for the sales as well. So I want to make sure that I hit that hard, because if you're out there pushing these products, pushing them to the people within your community, I want to make sure that you all are also getting credit for those sales. And we have a team of people working behind the scenes. As long as you can track them, they'll go in there and try to figure out what's going on with them and make any corrections, or at least give us the steps that we need to go through to get them fixed if needed. So track those sales. If at any time there's any questions about any of this material, please, of course, ask. I haven't seen any questions come up yet, which is fine. But any questions, feel free to ask. If there's any questions going on outside of this presentation, you can always use the 844 number. That's our national broker hotline for our broker support people to help answer any questions that you may have. Or you can use the email address, the nationalbroker@anthem.com. They will also be able to address and answer any questions that you guys may have. So one thing I did promise is showing everybody, and I sent this to you guys. You can post that out there on the website if you choose. But you can see these are the counties where in Georgia we're the only carrier of choice. And I know this might be quick here, but without naming them all, I'm just going to let you look at them. These are the counties in Georgia where we're the only carrier, and you can see pretty much all the way around the country, or all around the state, from South Georgia and Valdosta to somewhere in Vandalia, Macon, Augusta, Atlanta, and Jasper. But if you're selling in Virginia, you can see here some of the counties as well. So huge market for both Virginia as well as in Georgia. And here's in Georgia, kind of somewhere where we are new or re-entering into the market. As I mentioned before, many of the counties in the metropolitan area, many of the counties there in Gainesville. Huge contract now with a hospital chain, Northside Hospitals, which is really going to give us huge price reductions in premiums, which is going to help out, as well as there in Virginia as well. The market size in Georgia for 2019 is a little over 200,000 members. The marketplace there in Virginia should be closer around 300,000 people looking for coverage. So good opportunity. Great opportunity for Anthem and Messer Financial to focus on some of these re-entry areas, as well as where we're the sole carrier. And anything that we can do, Wes and myself, feel free to make sure you ask either now or email or call some of the broker customer service department, and we'll do what we can to get those questions answered for you. That's all I got for this afternoon. Did a lot of talking, so I'll go on mute here and see if there's any questions.
Yeah, a lot of really good information. Thank you for that, Mark. That's fantastic. It sounds like there's a lot of opportunity around. So, guys, this is the perfect time to take advantage of that. There are a few questions here. Number one is, and I think you've already answered this, but just as a recap, will Anthem be writing major medical in northern Georgia counties?
Yes, we will. So northern counties, so I know Rome, and the Rome, Georgia is kind of northern. You have Towns, which is Stevens, Reuben, Hart. I think that's going to be more of the northeastern states, northeastern counties, of Georgia will be available. The best thing to do is if you're questioning, because I don't know the county in question here, if you can always go to the Anthem portal and do a quote based on a zip code and see if it works for you. But we are in most parts of Georgia, and mostly in the northern parts as well. These are just re-entries, but if we sold it there last year, there's the Athens, so that's sold carrier. So to answer the question, yes. I just, without knowing the exact county, it's really hard to pinpoint the exact answer on that one. Sorry.
Hey, Mark and Mike. This is Wes, and thanks for. I was just going to add that we also sent. I don't know if Jeff sent to you, Micah. We sent another tab on a document we sent, has all the counties in every state broken down by both county and or rating region. So it's full participation. So that would be on a tab as well. I don't know if that might be something you guys want to post on your internal site, but that might help to questions like that as well.
Yeah, absolutely. We'll try to. I'll get with Jeff when he gets back in the office, and we'll make sure to get all that material out to everybody who attended this webinar. Another question is, maybe you could go back over and explain exactly what payment capture is.
What is payment capture? So mainly what I'm talking about payment capture is it's the on-exchange policies. On-exchange policies do not require a payment. So in most cases, when I use the example here, you go out and you purchase something at the local gas station or a pack of gum. When you purchase that gum, the attendant at the gas station captures your payment for that particular product. For on-exchange products, the payment or the premium is not necessarily required at the time of application, but we definitely recommend you trying to encourage your customer of making that payment at the time of application. That's what I mean by payment capture, because it's optional.
And looks like lastly, can a member select PCP on exchange application or off exchange application? It says membership phone lines get real busy to change PCPs when assigned when this starts out.
Mark, are you on mute?
Hello, Mark? Did we lose you?
Hey, I'm sorry, my phone dropped you. You there?
There you go. Yep, now we hear you.
Okay, sorry about that. I was in mid-sentence and talking to myself. So is the question about, can they choose their primary care physician at the time of application?
Yes.
Okay, the answer is yes. Yes, they can. Now, I use that example a lot of times is if they don't know who their primary care provider is, or they're just questioning it kind of in the back of their head. It's Anthem, if they leave it blank, Anthem, of course, will select one for them. And then they, of course, can update that at a later date. So you're right. Right out, if they get their ID cards, they want to make a change right away, you're right. The customer service number will probably be a little backed up. But if they know who their primary care, and they've done a provider search and they're okay with that doctor, go ahead, load it onto the application and submit it. No problem whatsoever. That doctor's name should show up on their ID card when they get it in the mail as well.
All right, well, that looks like it's pretty much it for the questions. Again, we want to thank both of you guys, Wes and Mark, for doing this for us. We greatly appreciate all the insight. I think we've got a lot of opportunity here to really push some sales. Also want to thank every agent that's on this webinar as well for attending. Like I said, we will get out all the available information to you for everybody that attended. And Mark, Wes, is there anything that you guys wanted to add before we close out?
No, I mean, I'll just stress again, I think I agree. Tons of opportunities in those two states. Really glad to be able to partner with Messer and the Messer family of agents out there, and whatever we can do to kind of help, continue to grow you guys' books of business. We're here to help support you guys. So thanks again.
And if you have any questions or you're not appointed yet or anything like that, feel free to contact Messer Financial directly. We'd be glad to help you. You can reach us directly at 866-568-9649. You can also go to our website, messerfinancial.com. All of our contact information is on there, and we'd be glad to get you appointed and ready to go. So thank you again to everyone, and good luck and happy selling. Have a great week. Bye-bye.
Thanks, guys.